The new program to access treatment for HIV and support more paths launched quietly last week. The team includes a nurse, a social worker, and an outreach worker. They're visiting encampments and other places to offer vulnerable people living with HIV medication and support. The Manitoba HIV program says rates of transmission are growing exponentially. Program lead Kimberly Templeton says they used to see around 100 new cases a year. This year, she expects that to spike well above 300.
And without any kind of meaningful change or intervention, we expect that trajectory to continue.
Templeton says part of that meaningful change is helping people get ready for treatment by building relationships and connecting them with things like affordable housing and mental health support. Mike Payne with Nine Circles Community Health Center says that's why they need to reach people where they're at. He says previous projects have shown street outreach works.
It made people feel important, and it made people feel cared for and respected. And that's something that a lot of the folks that we're meeting right now haven't felt when they encounter some of the other parts of our health and social service system.
Unlike most parts of Canada, half of the people entering the Manitoba HIV program are women. 50% of those women experienced homelessness, and nearly 2/3 say they've used injected drugs. About 7 in 10 of any gender are Indigenous. Laverne Gervais from Ganiganichik says her group is helping guide the PATHS team on culturally informed care.
It's not out there in any of the health clinics that we go to now. You might see some pictures on the wall, but that's not enough to tell somebody that they're welcomed. Right? It really is that relationship, and that part of that relationship is the culture.
The Manitoba HIV program says despite the alarming rise in cases, the PC government wouldn't support PATHS. It hopes the new NDP leadership will. Emily Brass, CBC News, Winnipeg.